the theme for this year's World Kidney Day is preparing for the unexpected and supporting the vulnerable, which I'm sure anyone watching this webinar will relate to on some level. At this point in time, I'm going to hand over to Helen Coolican, who is a director of PKD Australia, to do our acknowledgement of country, and then we'll go into a couple of other introductions as well. So over to you, Helen.
Thank you, Amy. I come to you today from Ngunnawal country and also acknowledge that we have presenters from Wurundjeri, Yorta Yorta, Gunnakunai in the south, and Jaeger and Turrbal in the north. In the spirit of reconciliation, polycystic kidney disease, Filter Your Future, and Data Victoria acknowledge and pay deep respect to the past, present, and future traditional custodians and elders of the lands, winds, and waters where we meet today. And a special mention to all our friends in Aotearoa, Kia ora, and Nome Nome. And if I can tell you a little bit about myself and PKD Australia, my name is Helen Coolican, and I'm one of the volunteer directors of PKD Australia. On behalf of Robert Gardos, our chairman, and Ian and Judy Cornell, who unfortunately are travelling today, I say happy World Kidney Day. Isn't it great that kidneys at last have got a mention? Our brief since we began in 2014 is to support research to find a cure, and our next grant round is open with a special interest in beginning researchers as well as established groups. As a mother of 4 young adults with PKD, I take to heart the words of Professor Gopi Rangan, who's head of the PKD Australia's Scientific Advisory Board, that there will be a cure for PKD in his professional lifetime. Until then, and as always, our role is to educate, advocate, and be a resource for those impacted by PKD. I believe the lived experience of PKD provides an awareness of others who are vulnerable, without water, without electricity, in war zones, natural disasters, or without access to kidney care in developing countries. There are times when so much in life is beyond our control. As Amy said, we all know this. And the stories, narratives, and accounts we'll hear today, I believe, will be an example of how people have managed. Then importantly, others feel that they are the first or they are alone. Knowledge is power. Thank you to all the presenters who are here today, and thank you to all the community who are sharing this very important day with us. Over to you, Amy.
Thanks, Helen. Angela, would you like to just say a couple of words?
Yes. Hello, everyone. I'm Angela Lindsay. I'm the Secretary for Data, Dialysis and Transplant Association of Victoria. Data commenced as the Home Dialysis Association in 1973 and became known as Data in 1981. The purpose of Data is to support people with chronic kidney disease, and the supports include bi-monthly magazine, monthly social outings, welfare grants, educational awards, and holiday homes. Data is run by a volunteer committee, and I do emphasise we are all volunteers on the committee, and at present it consists of transplant patients, donors, past carers, and supporters. Thank you.
Thanks, Angela. And Yvonne, who's our last partner to speak with you this morning.
Hi everybody, greetings from NAM in Melbourne and from Filter Your Future. In 2017, Filter Your Future was created to provide an education program for primary schools in Victoria to reduce the incidence of preventable chronic kidney disease caused by type 2 diabetes and high blood pressure. Free online lessons are now available across Australia and New Zealand, aligned to national curriculum. And a group of dedicated volunteers from DATA, the Dialysis and Transplant Association of Victoria, have provided ongoing support and sponsorship for the Healthy Kidneys Education Project, a unique contribution to our future generations. Over to you, Amy.
Thanks, Yvonne. Just for the benefit of everyone attending and also our presenters to an extent, today is really about sharing. It's not meant to be a particularly formal presentation or webinar, but certainly I'm sure will be very informative. There will be a combination, no doubt, of a good dose of drama in the stories, but also some light-hearted perspective as well, which I think is important for us all to, get through perhaps some of these unexpected situations that we might be dealing with. Yvonne will be helping me manage the event today. Helen and I may need to just duck out of the webinar a few minutes early, unfortunately, but fortunately we have been invited to an event at Parliament House here in Canberra, which will be very interesting in relation to Kidney Health Australia launching their report on the cost of kidney disease in Australia. So I'm sure you'll understand our having to exit 5 minutes early if we come to that. If you have any questions, please drop them in the chat or the Q&A. The Q&A doesn't seem to be working very well, so please feel free to just put anything you want to in the chat. It'd also be good to know what you were hoping to get out of today, just in a couple of words, and feel free to do that and share where you're watching us from. In terms of a bit more of an introduction about myself, one of our first presenter, Dr. Maged Fahim, knows me from when I donated a kidney to my husband, Mark, in 2016. It's nearly 7 years. Maged is a little more grey than he was when we first met. And I'm not taking any responsibility for that occurring. It's his children, I'm sure. One of the things that I think came up just recently, as I was mentioning to some of the panelists earlier, was last week I was to have a tropical week in Vanuatu with my husband, making sure, of course, that he had packed enough medication for the trip overseas, because you never know when you're going to get stuck. And we went to Vanuatu and had 2 cyclones within 3 days. And the first one was pretty bad. We thought, oh, gee, that was pretty nasty. And then the second one came through and that was worse than the first one. So scary, no power, no water for a while. Some of the ceiling flew off. I feel like I've sort of had a good warm up for the topic here. But one thing that I really took away from that experience was communication was the key in that. So if there was no update to a situation that we were in the middle of by authorities, be it the Australian High Commission, be it any Vanuatu authorities, no update is an update in itself. And so communication with people and keeping that open was something that I noticed was perhaps a little lacking. And I don't mean that by any criticism to the situation there, because it was dire for everybody, but just a takeaway for me. So that's a little bit of an intro about me, but I'm going to move on now to introduce you to Dr. Maged Fahim, who is going to share some experience with us. Maged is a senior staff specialist nephrologist at the Princess Alexandra Hospital, and he also has the role of Chief Clinical Information Specialist for Metro North in Brisbane. So Maged has hands in 2 different areas, which I think for this morning's topic will be really helpful. So Maged, over to you, and thank you.
Thanks very much, Amy. It's very kind. I guess I've been tasked with talking about sort of the impacts of COVID that had in the health system and in renal in particular. And as Amy pointed out, I wear two different hats. I wear a direct care hat, where I look after, I have the privilege of looking after a cohort of individuals with chronic kidney disease of various types and various types of kidney therapies. And at the same time, I wear a sort of systems hat, designing and implementing clinical information processes and systems. And, you know, it comes as no secret we were unprepared for something like COVID at a massive system level. And it was quite, we had to act quickly. And while I'm proud of what we achieved, I do mourn some of the aspects, if I have to use a word. And it's because, I guess, the lack of preparedness creates risk in that you won't be able to do everything, and you might get what probably most people in hindsight would argue the most important things right, but you probably going to drop the ball on a few other important things. And by that, I mean communication, which is what really Amy highlighted. And that was the big thing for me, sitting on both sides of knowing how much people were scrambling to plug gaps in information systems, in monitoring health, in understanding impacts, in looking after, ensuring there were appropriate staffing levels. So all very valid and really critical things to ensure the health and safety of the community and the support for the community. But because we were scrambling to do this in such a short period of time, actually talking to people and partnering with them, which is really one of the crucial facets of clinical care, and particularly kidney care, it was less than ideal. Because you know, I would say it's akin to, you know, if someone was bleeding in front of me, I would probably just rip off something and tie their leg without even talking to them, and that's not ideal because I'm tying up something around your leg, but I need to save your life, and I just need to do this, and that's not ideal, but that's very much a situation we were in. I saw the impacts of it on some of my own patients, and you know, the screening at dialysis units to do RAT tests every time, the wearing masks in dialysis units, the fall away from face-to-face clinics, which was a good and bad thing, and I'll talk about that in a second. The delays that came, you know, again, we all know that kidney care is actually multidisciplinary, not only within kidney medicine, but across different disciplines. Individuals with kidney problems often have required the services of multiple other specialties. And so, you know, suddenly creating stress on the system made that coordination of what is already a complex exercise 3 times more difficult. It clearly had an impact on beds and our ability to admit people, but also no doubt on transplantation. And that was on both sides of the equation, on donation, with intensive care units being under incredible pressure and not able to have those conversations, or have those conversations in a way that they normally would, in terms of being able to accommodate, you know, very few of our transplant recipients will end up in intensive care after a transplant. Thank goodness for that. That's a very uncommon outcome, but nonetheless, it's a possible outcome. And knowing that that could possibly not be accommodated factored into many of the decisions that happen. Things that we hadn't thought of. Things like, well, we actually rely on commercial flights to move kidneys around the country, and all the flights ground to a halt because no one was flying. suddenly became, you know, moving a kidney from one city to the other, which was a nothing decision. You know, it was, well, we've got 9 flights or 20 flights from Melbourne to Brisbane. It's okay, you miss one, doesn't matter, there's another one in 20 minutes. Became a $20,000 rent a private jet exercise. And that's not to say it's not worth it. It's just that really many things we take for granted at the moment suddenly became big deals. For the recipients, it was obviously incredibly stressful, both in terms of understanding their risk, in terms of contracting, but also for potential recipients, the very difficult decision units had to make at the time about making vaccination a requirement in order to get on the list, which I understand was very painful and a very polarizing decision, and not one, and I hope you believe me, not one that was made easily and judgmentally. It was made and openly declared to be one that we would revise periodically, and one that was made in consultation with units not only within Australia but across the world, and one that's now being revised. One that was certainly in our unit, it was something we revised or looked at the very least every 3 months, but one that we have now said we think it's the right time where it's no longer a mandatory requirement to get on the list. It was still highly recommended. We still strongly believe in it. We still strongly believe that that it's the safest thing you can do to protect yourself. But we also try not to, you know, and I hope this is a reflection of the fact that this wasn't a paternalistic decision that was being made, but was trying to be made in the best interest of everyone. Is an awareness that at some point it can become paternalistic to continue to mandate that. And with the change in the pathogenicity of the virus and the environment we're in and our ability to accommodate deterioration, that decision's been made. So needless to say, it's a very stressful time. It was also a very, a time that showed us, I think for me, from a system level, I got to know my team. So my team is still a multidisciplinary team with my other hat on, but it's a different multidisciplinary team. It's a team of application developers, data analysts, business analysts, trainers. And we develop clinical information systems and implement them. And we did some pretty amazing things in a short period of time, many of which got taken up nationally, and we're very, you know, we're very privileged to have been able to help. But I think it showed that we can deliver care in different ways. It also showed that you need to keep an open mind, that it's not one extreme or the other. It's not you have to come and see me face to face or not at all, nor is it 100% telehealth or telephone. That there is a middle ground, and it's giving people that option to be flexible and to support people while still being flexible. I think it highlighted again the criticality of communication. I think should we do it all over again, there would have been better discussion and forecasting to explain to people why some of these decisions were being made, and to be able to communicate more transparently and clearly. I think that kind of change management and change impact was probably, well, I know it wasn't done well, and we can definitely do a better job. And I think that's become we're very cognizant of that. It highlighted to us the importance of our tools and information systems, that they are as critical, I think, as our stethoscope and our drugs to actually achieving important clinical outcomes. And you know, I think if you ask any clinician in the kidney service about partnerships, both amongst clinicians and with the people they look after, they would, in a heartbeat and sincerely say it is. You know, as an example of this, when I got my job at Metro North, I got asked to move my clinical practice to Metro North, and I can't, because that would mean I couldn't look after the people I've looked after for 10 to 15 years, and I'm not doing that. So we do value it. We do. It's not just a job, and we don't just, you know, it's not that every person's just the same and it's just another person. We do actually care very much about the people we look after, and we value the relationship and the partnership. And I think doing it again, we should have, and what we've learned is we should have relied on those partnerships and relationships to help us. That we shouldn't have felt we had to do it all ourselves or not do it because we had so many other things to do. So I'm sorry, that was a bit rambly, but I hope it was insightful into what was happening a bit behind the scenes, what we thought we did well. And I do think from a purely systems perspective, what could have happened, and I did have very deep insight into what was happening, and to the point of thinking, you know, planning to go, this is going to get out of control before we started the lockdowns. Again, a very polarizing topic, but to go, this is going to happen. People will die. Being in conversations where people said, were nihilistic about things and said, this is just going to happen and we just need to accept it. And equally being in some heated discussions, telling people to not be so nihilistic and to pull their head in and to stay the course. You know, to the point of planning, I need to finish all these systems and get them done in the next 3 months, because I'm going to be probably working in the hospital for weeks on end and not seeing my children, yeah, it was very real and very scary, and it could have panned out incredibly differently. And I'm very proud of the health system in Australia having, from where we started, have to steer, and what the government did, steer us, you know, in a different direction. It wasn't seamlessly executed, I will not lie. It could have been done much better. I think we've learned from that, those lessons aren't going to be forgotten and are being implemented. Again, with my systems hat on, I can tell you people aren't saying, oh, well, that's done, everyone back to work, status quo. Things are being put in place to try and take the right things forward.
Thanks, Maggot. Yeah, and I can understand all of the points you've made, and it's nice to hear the reflection and the honesty. Though I think we all understand, the attendees and the panelists, that it was a unique situation, and I'm sure everybody here is going to talk along the lines of it being a unique situation, whether it's COVID or the other emergency that they're experiencing. And you know, 99.9% of people are going to do their best, and particularly when you're in a position of a profession like you are. So thank you so much for joining us, Maggot. I know you've got to go and actually do your real work.
Yeah, sorry, I've got to go back to clinic.
And I'll pay you something later. Thanks, Maggot.
Thank you, everyone. Bye.
See ya.
Thank you.
Belinda, over to you. And I am going to share my screen with everyone, and we're going to hear from Belinda. So Belinda Jones is the Deputy Program Manager for the paired kidney exchange program, working within Donate Life. But of course, you know, an incredible program in itself. So I will just do this and then do this, and hopefully everyone will be able to see that.
Ooh,
And
thank you.
Over to you, Belinda.
Thank you, and happy World Kidney Day, everybody. It's interesting how much I can resonate with what Maggot had to say, actually. The good, the bad, and I guess the ugly. But we've certainly learnt some lessons from it. which is a good thing. So today I come to you with a perspective from the Australian and New Zealand Paired Kidney Exchange Program, of which I am one person in a very big cog and wheel. I'm the Deputy Program Coordinator for the Australian side of the program. And I'm just like to acknowledge my colleagues in that program, but also a shout out to my New Zealand counterparts, given we are now a joined program and have been for a number of years. Do you mind passing on to the next slide, please? Thank you. So I guess in some ways Majid has touched on some of our shared interest and conflictions when it comes to COVID. It certainly hasn't been the only natural disaster that's impacted our service. We've had Victorian bushfires, we've had flooding as well, particularly in our border towns, that have affected the way we've been able to manage our service to our pairs. But to be fair, the biggest impact really has been COVID-19. To run through a few of those things, in particular, access to donor testing. So those people who have put their hand up to be a donor and be assessed have during COVID found it particularly difficult to do so through access to services because of travel restrictions, because of anxieties, concerns, government protocols about what is or isn't available to be done at that particular time. That has led, not necessarily now, but certainly did lead to a decrease in the number of donors that we were seeing worked up, and certainly to a longer time frame for those donors to be able to get through their process and enter the program. The other thing that we were seeing was the recipient access to vaccination, and Majid has already touched on that. My other hat, which I probably should have mentioned earlier, when I'm not in this role, is a vaccination nurse. So I spent a great deal of 2020 and 2021, when I wasn't in this role, at the big mass vaccination sites in Melbourne, working some crazy hours to see people through massive big lines to be vaccinated. So that, I mean, that's a whole nother, that was a whole nother experience on top of this one. People did find it particularly frustrating. People found it very hard to access, and it was certainly a difficult time for both people accessing, but also people vaccinating, if I do say so. With regards to the program, so we are responsible for finding matches for incompatible pairs and then facilitating the safe donation and moving it around the states and sometimes across the Tasman to recipients. Of course, we had, you can see up in the top corner here, we had all sorts of different state restrictions at the time. And we also had a no-go zone for flights out to New Zealand. So this was a particularly challenging time. We were not able to match pairs between the two countries. And for a period of time, we needed to operate as separate pools or separate identities of people. As Majid again has also touched on, flights were difficult to come by. I mean, usually you will see things between, say, Melbourne and Sydney, hourly flights, half-hourly flights. But due to the nature of lockdowns, we were down to things like the government was actually funding one leg per state only per airline. And that is not enough to run a pool safely. It's not enough to do an exchange. We always have backup flights, extra backup flights, and without those flights, it's not safe to complete an exchange. So it got really challenging. We would have pairs set up, we would have exchanges ready to go, and then there would be a state premier who would decide that we were locked out of a particular state, flights would be cancelled, and we would need to reschedule an exchange. So we needed to think outside the box, and I might get you to go into the next page if that's all right. This was our thinking outside the box. So this is Steve here, and he is operating a charter plane outside of Essendon Airport, this particular one. And this is how we got around some of our exchanges. This particular instance, he was flying 1 kidney up to New South Wales and returning with 2 for 2 Victorian recipients on the one day. That in itself, and look, Magic has again touched on it, it's quite an expensive exercise when you're looking at a charter plane versus a domestic flight. But this was 3 recipients in one go, and well and truly worth its weight in gold. We had other legs where it was not possible to be able to facilitate a charter flight. For example, Melbourne to Perth. Quotes for one way with a charter flight are in excess of $35,000, and just unfortunately just not able to be facilitated. So we're very thankful for this service, and we were able to continue exchanging at lower levels, but certainly able to still facilitate transplantation during COVID. Next page. I do wish to just put a shout out that the program itself, while Emma and I do coordinate the logistics of the program, we cannot do it without Star Trek. Their service is amazing. They are a go-to-woe service, track everything, have contingency plans in place for the safe delivery of all our kidney donations. And have also been exceptional in re-establishing our relationship and getting our trans-Tasman kidneys over the line again. So we did stop for a while, as I said, because there was no flights going across to New Zealand. I'm very pleased that we have got that service up and running again, and have been transporting kidneys between the 2 countries since September last year. Yeah. I think that might be the end of my actual slides.
I think it is the last slide. Yeah.
Yeah. I got, yeah. I think the biggest thing is it really hasn't been easy for anybody. And Magic is right, communication is key, absolutely key. And it's fine for us to, we're setting up an exchange, but when decisions are made at higher levels and that control is taken away from you, it's even difficult at our level. So we appreciate that it's incredibly difficult at the patient level as well. And there were certainly a lot of uncomfortable decisions and difficult things that we needed to navigate with our pairs through this. I'm very pleased that we've kind of come out the other side, so to speak.
Yeah, I think I don't think everyone's aware, but Belinda's actually got an exchange happening today, so that's why her phone might be dinging, and so we appreciate that you're juggling all of that and this as well. But it's a great insight, and I know we all value the paired kidney exchange, particularly our next speaker's Kellyanne Grant. But I know that what must go on in the background is phenomenal. So Belinda, yeah, look, I can imagine dealing with all of those cross-border issues through COVID must have been extremely difficult.
We noted too. I mean, and I think this is more across the board. There were huge impacts to staffing and just generally across the board, and certainly in healthcare, anyone who was free was redeployed. or a job change or added into something else to be used somewhere else. But we found the same with other services. So re-establishing our Trans-Tasman exchanges meant that the contacts that we had in Qantas and Air New Zealand, for example, no longer existed. They'd unfortunately lost their jobs through restructuring. And so that process of finding the right person and re-engaging and getting that program up and running again was certainly a big process. But probably something that we've all experienced. There are lots of changes in roles and jobs and diversifying and
No, well, look, thanks so much, Belinda, and I'm sure everyone's learned not only a bit about the service itself, but the difficulties that you've faced and overcome, and as a healthcare worker, I'm sure we all thank you sincerely. I know we've got a lot of healthcare workers here, but you know, it's an amazing job that you guys do. So thank you so much, Belinda, for joining us.
thank you.
There was just one question there, Amy, from for Belinda, Angela, just asking, did you lose any kidneys during this time?
Is that in the context of logistics? I mean, no, we haven't.
I was just wondering whether you actually had a, sorry, it was my question.
Oh, yeah.
Did you lose any kidneys, like you were prepared, the person was in hospital, you sent the flight over to, say, Sydney? Oh, that's good.
No. So the logistics are such that, there's 2 and 3 levels of criteria that need to be met for it to be safe. So there's backup flights, donors start at the same time. There's a lot of communication that takes place. And if those features aren't met, then things are cancelled or postponed until everything can be met for safety. So no.
Well, because I mean, one kidney is so precious. So
absolutely, yes, yeah. No, you can't put there's so many backup plans, it's unbelievable.
Thanks, Angela. Good question, and thanks again, Belinda. I'm going to pass over to Kelly and Grant Ottaway, who are joining us from Bairnsdale. Kelly is a transplant recipient and Grant is a donor. It's not straightforward, their story by any means, but I'll hand over to them to fill you in on the details. So thanks, Kelly and Grant, over to you.
Thanks, Amy. Now, I've actually been a type 1 diabetic for 46 years now. And in that time, I've been on and off hemodialysis for about 20 years. I've had 3 transplants over the years, and the recent one was last year, where Grant donated a kidney in the paired kidney exchange, like Belinda was just telling us about. And I was fortunate to receive a kidney. But I just wanted to tell you about an incident, how we were impacted when I was on hemodialysis and doing it from home. And that was back in 2006, and in East Gippsland, Victoria, which is where we were living in a rural area. We were living in our shed at the time and with our daughter, Kayla. Yeah, while we were building our house. And I was dialysing in the shed. So, and then we had, on the 1st of December that year, we had fires flaring up all over East Gippsland. And as a result, we were impacted by these fires for about 11 weeks. And we just sort of wanted to give you a bit of an insight in what it was like being on dialysis and being impacted by those fires. Because it was over 11 weeks, you know, we had our car packed ready to just leave if we had to. Doing dialysis was quite nerve-wracking because, you know, you didn't know if you were going to have to leave and when you were going to have to leave. And if I was on dialysis, I mean, it doesn't take 2 minutes to come off the machine or anything. So you know, you would have needed a good 20 minutes to get out of there, but you may not have had that time. So so that was quite an intense time in our lives, and just all the smoke we had for 11 weeks, and we had embers falling, and we were also on tank water, which I might pass this over to Grant because he understands that more than I do with regards to dialysing.
Yeah, so one of the main problems that we experienced with the dialysis equipment set up. So in short, what we had was a tin shed, which was our temporary accommodation whilst we were building, and we were in a heavily treed area, so lots of natural bush around us, very beautiful, but also not the ideal location to be in while there's bushfires raging around you. So I think that during the time that Kelly was dialysing every second night, so it's nocturnal dialysis, having tank water, we had a number of unforeseen issues arise that we were ill prepared for, and actually hadn't put much thought into. So when we were thinking originally, okay, bushfires are coming, we're listening to the news, and falling back to communications, we were relying heavily on all the local updates from the CFA, and we could actually see the fires in the distance from our property. So we had the not only the added stress even for normal family environment where you've got bushfires in your in your locality, but also having the need to make sure that our residence is actually safe and that we have proper power supply and proper water supply for the dialysis, because the last thing we needed to do was to become isolated from our local community, bushfires cutting us off as such. For us, there is no other way around to get to a dialysis centre, for example. So during the fires, fires are a cruel thing. You get bushfires, and then you also get, a little bit of rain, but not quite enough to put the fire out, just enough to just dampen things down. And one of the problems with the fires that we encountered was soot and other particulates in the atmosphere. So we've got the fires roaring away. You would then walk out and you would find our white cars have now turned grey from soot that has fallen back down with any moisture that may come down at night. This is a result actually coated our roof with grey soot and other particulates. That stuff ends up getting washed down and ends up inside your water tanks, and it wreaks absolute havoc with the dialysis equipment. So we had the RO going into alarm continually, saying that basically there's just errors with it because the membrane filters are becoming clogged. So trying to deal with that was one problem. So changing a lot of filters continually, but then also the no guarantee that we actually had a reliable power source. One thing we did have the forward vision with when we were actually setting up there, we were aware that we were in a rural area. So we did have town power, but we also had a big generator as a backup plan as well. So where we had tried to think of everything when we were setting up dialysis is that we needed to have redundancy, but there were a number of things we did very, very well, but then there were also a number of things that we didn't think of, and one of them was actually the rooftop contamination. During our time at Sarsfield, where we were living, we did actually encounter quite a few bushfires. So what we had worked out with Monash Medical Centre, who were our suppliers of everything dialysis, was to actually give us a complete spare RO system so that we could essentially do a hot swap. With the ROs, they have an internal membrane which you can't change out in the field. So so they have to go back to Monash to get serviced. So learning each time we had a natural disaster, we actually ticked more things off our redundancy list as such. So we had spare RO. Another thing we did was we actually had improved and better water filtration as well. And then also learning that we can't that we need to clean our rooftops. So what we do is divert the drains and the runoffs, and then wash the roof as such, get all the junk off it. We had not only with the bushfires, but we also had a number of floods as well. So it's sort of the joys of living in Victoria's East. You get bushfires one month and then big floods the other. And so what we also had with floods is we had this two obstacles in between us and town. One of them was called the Nicholson River and the other one's called the Mitchell River. And so both roads were actually blocked. So what we started to do was to make sure that we had adequate medical supplies and equipment in our store for Kelly to last her a very long time, plus lots and lots of spare parts. And I think that when you're dealing with, I'll just say life support or that type of caliber of equipment, is that, and things aren't going well, is that everything becomes a little bit harder, where you've got equipment that's going into alarm all night. And like Kelly said, 11 weeks of bushfires. Although our property, we had falling embers and we didn't have any fires on our actual property, other neighbouring properties did. But fatigue is probably one of the biggest challenges as well. So it's very hard to think clearly in the middle of the night when you've got embers, falling around you, dialysis equipment sort of, wanting to beep an alarm and everything like that. And you've just had months of dealing with smoke inhalation, soot and all this other crap, and you just get tired. And it's very hard to keep a cool head, think clearly and just stay focused on what you're doing. Some days you just need to have a complete reset and just take a big breath and then, sort of, get your head space right to deal with it. And I think I'd probably like to, I'm putting up the Monash on here at the moment, but, just extend a huge thanks to everybody involved there, but especially the technical team who were my rock, because at the end of the day, or the end of the night, whatever you want to call it, when Kelly's on dialysis, my job is to stop the machine beeping, fix things, and just try to sort out the equipment when it's playing up. And these guys, around the clock, we had 24/7 access to their techs, and they could step us through basic repairs, recalibrating the equipment to accommodate for everything from not only soot and particulates, but another thing that we didn't realise is the ambient water temperature. So we've got outside water tanks. When you turn your tap on from town water, the water comes out nice and cool. You go through a summer with above ground tanks and the water heats up, and the dialysis equipment doesn't like that because the temperature's too hot. So just things like that. So I think it's where we've learnt a lot is that it's very important to, where Kelly had to learn how to, obviously connect up to the dialysis and go through that process every second day, for whoever's I'll just say in charge of support as such, is that they need to have an intimate understanding of how the dialysis equipment works mechanically. So I'm not saying like be a technician and pull the thing apart and fix it, but you've just got to be fluent with all the parameters and a good understanding as to how the machine works. It's not magic. It doesn't just work. It actually does lots of things to work, and you need to understand every aspect of that equipment. So so that's super, super important. So the advice I could probably give to anyone who is on dialysis in a rural area where they need to have a certain level of self-sufficiency is to spend good time and establish solid relationships with the technical people from your dialysis centre, and ask lots of questions. These guys are happy to give answers. You just ask, you discuss how the equipment works, and if you can do that, you take the burden off the hospital guys, because sometimes, like during a bushfire, they cannot physically get to you. When they have a flood, they can't get to you. So, like it or not, you're it. And so it's really important to actually suck all the information in and be responsible. the best you can for your own maintenance and of the equipment, and just make sure that you keep the wheels turning as such.
And sorry.
Thank you, Grant. I'm just taking over from Amy and Helen, who have to go off to Parliament House and represent us all there. And we wish you well for Happy World Kidney Day there. And we're going to just go to Justin, who's got a few slides that being pulled up there now. Justin's. Are you enabling the slides there, Amy?
Sorry, Justin, are you able to do that in case I need to leave before you finish the slideshow? I mean, sorry.
I think you have to transfer me over to being the host to be able to do that.
Ah,
That will be the only.
okay. I'm going to make you a co-host. You want to try that now? Give it a second. Sorry about that, everyone.
Yep.
That should hopefully be coming through. Oh, there we go. Is that working? Yeah.
Give me a second. Cool. Can everyone see? Everyone see that okay?
That's great. Thank you.
Cool. All right. Thank you very much. Been invited to speak today. I'll head off and just give a little bit of background. Obviously, Australia is a home of fire, wind, and floods, which all affect us. So we're very aware that fire is one of our greatest resources. It's a natural use in our Australian climate, cleanse the land, growth, etc. The Aboriginal people have used I'm just going to close this down for a second. Which one are you guys still seeing the slideshow or not?
Yes.
Yep. Okay. All right. I just want to go a bit about history of bushfires. I guess in my time, I recall certainly the ash fire bushfires in 1983. My grandparents remember the Black Friday fires in 1939. My parents, 65 fires. And then my children have been exposed to the Black Saturday and most recently the Black Summer fires of 2019 to 2020. So at the time there was immense panic and fear at the time. Sorry. So at the time, certainly there was a sense of panic and fear, loss. There was also safety, support, protection, and provide. And there was a lot of people just saying that it'll be okay. This is a picture taken looking out across Buchan on New Year's Day. At the time, we actually had friends come down from Melbourne, camping in the region at the time, and I was actually at work on on New Year's Eve day. They came in and stayed at our place, and at the time they actually disappeared from us. They left in the middle of the day because they actually watched the news and thought that whole of Gippsland was going to be impacted. So they disappeared like a lot of people, which caused havoc on the roads. So this is a photo taken from the middle of Bensdale, looking at towards Clifton Creek. The fires were actually about 8 kilometres from my home, and probably around about direct line, probably around about 20 kilometres from the Bensdale Hospital. So just looking at the planning that a health service takes. So we've had many previous experiences managing bushfires and natural disasters. We currently have a fire preparedness program, emergency planning. This covers an immense amount of information. Its aim is to provide effective planning for all of its emergencies that may place, maximising safety and well-being of the people in recipient of service in the East Gippsland area. It also ensures that we're able to continue to provide a service. It also looks at basic things also that you're not that aware of at times, providing medical equipment to outlying areas as well. So your bush nursing services, right through to just putting out general information to the community regarding care in heat waves for dehydration and things like that. Whilst we experience bushfires and natural disasters at the time, we always continue to learn and develop new frameworks to ensure that we're able to provide the service that we're able to do. So you can see the map there. I'll just go to the next, give you a little bit of information on who we are. We're a satellite unit of the Austin Health. We're a 9-chair unit, currently with 12 part-time staff. And at the time of the fires, we had 21 patients. A quick overview of dialysis, if anyone's not familiar with it. I know Kelly and Grant certainly are. You need the key ingredients: water, power, a machine, equipment, and obviously someone to operate the machine. Our other neighbouring units is Sale and then Orbost, which is further on down the road. So I'll just give you a little bit of an overview here. So we've got Bensdale, Orbost, which is about an hour away, an hour and 20, and then Sale the other side. So about 50 minutes. So this is a overview of the fire damage that you can see. So you can see how close it came to Bensdale. Buchan and Orbost certainly cut off quite heavily here. The actual fire started on the 30th of December and burnt right through to mid-February and into March as well. It was declared a state of emergency on January the 2nd, which was actually a very good thing by the state, because it actually got rid of a lot of the tourist people that visit the East Gippsland area, which helped with housing and things like that for people that were affected. So at the time, there was immense communication to all of the units within BRHS. There were up-to-date reports on the fire. Included in that is emergency services, big roads, road closures affected, whether staff or patients could get into dialysis for their treatment. Orbost Health Service transferred one of their patients to us. Fortunately, they had family in Bensdale, so if they hadn't, we may have struggled very much so to accommodate them with all the additional people in the area fighting fires. Knowing where your staff and patients reside is a key in coordinating treatment. Many of the staff made choices to defend their own property. Some, at the time, we didn't have any patients that made that choice. We were able to relocate them into town. So there was a lot of liaising with regional units, whether they were able to assist us if we needed to transfer any of our patients to their care. Obviously, a lot of communication with the treating nephrologist who supported our team as well. During this actual experience, as Kelly said, there was fires here in 2006, and I was employed here at that point. I actually felt quite prepared as we negotiated quite a number of natural disasters with fire and flood, and we had an understanding of how it affected our patients and the community, and what we needed to provide to them so that they could get safe care, and also having staff to care as well. So a lot of the time staff would be in town. We just move them into town if they're in outlying areas. So one of our key things with dialysis is water. So here's what usually our river systems look like on the left-hand side, and the right-hand side is what the river systems look like after we got some rain at times. So our town water is actually, at the time, is treated with higher chlorine at the time to reduce the amount of bacteria and toxins in the water. So again, like Grant was saying, you need to know your equipment and how that works. We were quite fortunate in these fires that our water quality was not affected, as we weren't relying on tank water. East Gippsland is usually, the water quality is affected more so when the fires are located in the Dargo area. East Gippsland Water were in regular contact with us though, and with our renal technicians, our central water plant. This continued for a number of weeks as the water quality, still the chlorine counts were quite high, so we had to adjust quite a number of things. Obviously, Grant and Kelly have spoken about contaminants, which literally last for months, and our systems are still affected by it. Post the bushfire, I think we're still in quite a period where there are still road closures that impact a lot of the bush areas and things like that. But also at the time, knowing what roads, like I said, are impacted and for how long is quite a thing, and liaising with state emergency services to get people through road closures certainly was very coordinated. At BRHS, and like probably all health services, we evaluate our emergency plans annually, taking in learning and experience gained from emergencies, much like the nephrologist was talking earlier about reflecting on things with COVID, what you can do better and how we can improve in the future. One thing in a community is a natural disaster like this can continue to impact a person quite significantly for a lifetime, whether it's the fire directly or whether it's financial or other health impacts. Like Kelly was saying, we're inundated with smoke for months during a period of bushfire. So I think we tend to reflect a lot on the experience and then put plans in place so that I will learn from them. So it is quite an impact on the patients if they have to move into town for a period of time away from family or away from their local community support. So that's about all. If anyone's got any questions.
Can I just make mention? I just wanted to also say that thank you to Justin and his team, because during all the natural disasters we've had in East Gippsland area, Justin and his team have always offered for me to come in and dialyse at his centre if need be. So I just wanted to mention that. Thanks, Justin.
Not a problem.
I'd like to say, Justin, are you able to hang around for if there's time for questions after Lynn speaks?
Yes, certainly.
Thank you. And I didn't give Justin his full introduction because you've probably gathered now he's a renal nurse unit manager at Bairnsdale Regional Health. And now we're going to flip over to Lynn Jefferson, who's also the equivalent at Echuca, where they've had a bit of water going down the Murray River. So Lynn, over to you. And then after that, we'll be having Q&A. Are you able to, is everyone able to stay on the panel for the, we're going over time, but I think we're all enjoying having the chat. So let's go to you now, Lynn, and thank you very much for waiting patiently.
Thanks, Yvonne. Unfortunately, I'm not able to share my screen. I think it's been disabled. So if someone could help with that, that'd be great. It's a little bit of a tricky one, the IT side of things.
Yeah, I'm sorry about that. It's we've had all these last minute little things, but we're doing the best we can. Unfortunately, I don't have a copy of your slides, so I can't share it. But so
Yes.
you were
Justin, as
made
a co-host, can you allow that? While we're just waiting, I'll just kick off anyway. So, you know, in the interest of time for everyone, and yes, my name's Lynn. I'm a nurse unit manager from Echuca Regional Health, which is located in northern Victoria. We're on the border of New South Wales, along the Murray River, and my talk's really focusing on flood and the impact of the recent floods in October on our health service and on people needing to come for their regular hemodialysis and what we did about it. So just a little bit of background and the geography of the area. We have three major rivers, all coming together around Echuca. So we have the Murray River, the Goulburn River and the Campaspe River. We've got low-lying areas and we have water catchments located upstream of all of those rivers. So it's kind of it's good when we have enough water coming down the river, but when we have too much, it's an inevitability that resulted in the floods we experienced in October. So we had rain events of high intensity and sodden catchments with the La Nina. That's how you say it properly. I'm not a meteorologist, so apologies to that. And so I guess we knew, had a little bit advanced warning that we were going to experience some flooding, but we weren't really prepared for the intensity, the speed and the, I guess, the impact of the amount of water coming down the river to us. Our health service here, it's rural health service or sub-regional. We have 75 acute beds, 68 care beds, an emergency department, and I manage the Cancer and Wellness Centre, which incorporates our dialysis unit as well. We have 6 chairs that are allocated for dialysis, and we currently operate 3 days a week. And we luckily have some capacity to flex where possible. Our population between Echuca and Moama, which is directly on the other side of the Murray River, a town in New South Wales, is around about 45,000 people. So I wish I could show you my photos because they're quite shocking. So maybe I'll hold this up. It's a bit awkward. Not working.
Getting closer.
No, that's not going to work for us. Anyway, I mean, people may have been able to Google them, but the Bureau advised us of major flooding higher than 2016 or similar and exceeding the 1993 floods. And of course, that have rung alarm bells for everyone because those flood levels, particularly 1993, meant that houses were going to go under in our towns. I don't know. You can see here we have, we called in the ADF, not me personally, and a whole raft of volunteers. So the Defence Force were deployed to help us with sandbagging. And the event officially started on the 6th of October. By the 16th of October, we were advised 1,000 properties were expected to be impacted. And then we had the evacuate immediately warnings for Echuca and Echuca Village surrounding areas. There were road closures in place through the twin towns, and including our major thoroughfares, which for people accessing to the hospital, which is located centrally in the town, meant that some people living not in the central area may not have been able to get to their regular dialysis. So of course, when this happens, it's a scramble, and location matters in a natural disaster. So we, our closest other health services that may have been able to help us was Shepparton, which is an hour away, Bendigo, also an hour away, Deniliquin, 76 kilometres away, and Kyabram, also about half an hour away. However, Shepparton and Kyabram were also located on the Golden Valley River or thereabouts, and also impacted by floods. And we were uncertain of the roads between Bendigo and Echuca as well. So it was quite an isolating experience, and very uncertain for people knowing, are they going to get to their local dialysis unit because the roads within the town were cut off, but also could they then get to other more close towns to have their dialysis as well. So you can understand the anxiety that people felt at this stage. So our goals at this point in time, we really had to regroup as a health service very quickly, was communicating with the right people at the right time. We had a hospital incident management team set up and emergency team briefings daily. That flowed down to our service level team meetings within our dialysis unit and our cancer unit, because of course we had not only dialysis patients to think about, but also our chemotherapy patients. Thinking about who was going to be impacted, understanding where people live and where they were coming from. So orientating our patients to the current and anticipated situation was important. That communication and personal communication, as obviously it's a very worrying time for everyone. Identifying the challenges that were likely to come forward from this. So access to the centre, water quality, the infrastructure. Did we have enough capacity to offer more treatment here if people needed to come here from Kyabram or Shepparton, because they were also impacted by flooding? Putting all that together and knowing that we needed to be flexible. Whatever plans we made, we needed to know we could change it on a daily basis because it was evolving every day. We were advised of different water levels, different areas that were flooded, channel banks that were breaking, and then flooding areas that was not expected to flood, and those sorts of evolving situations. So we had to work quickly to ensure access for dialysis treatment for those who were affected. So knowing our people well, where did they live? How did they get to dialysis? Who brought them? What was the impact there? Who could they go to if they had family that lived elsewhere that they might go down to early to avoid being cut off and to get more support that way? We had to support people and assist them to navigate access to care. So negotiation, understanding that levels of dependence or independence and supports in place was really important. So as a team, the nurses delivering the care, working closely with patients around those aspects. And so we couldn't do it all alone, and we needed to collaborate with our local and metro partners to achieve our goals. And local collaboration looked like us quickly forming a little collaborative group of the neighbouring dialysis unit managers, and we would have a daily Zoom meeting and talk about where our patients were living, what the situation on the day was, had anything changed, was it likely certain roads or spaces were going to be blocked off. So for example, patients who lived in Moama could go up to Deniliquin and access that safely rather than coming here. We took patients from Kahuna, which is downriver from us, but they lived more locally to here. So we were able to offer chairs for people. Some of our patients we asked to think about going to family, and we had someone actually go down to dialysis in Melbourne at Austin Health, and Austin is our parent hospital. So they were very helpful in supporting that, and family felt a lot safer that they knew that their elderly parents were down with them and being looked after and not in danger. And so our local collaborative group was really effective in making plans quickly and helping to assist people to know what their fallback plan was if they weren't going to be able to access our dialysis unit on the day that they needed to. Again, themes coming through, we worked closely with our technical team support in water quality and managing our dialysis supplies. And in flood, it's difficult to know if your dialysis consumables are going to come through in time. So you need to know that you've got enough dialyzers and enough dialysate and all those things needed. So partnering with Baxter and the team there to make sure we had enough supplies. So that was what the health service did. And then I'd like to reflect on the patient experience. So talking with people through this, you know, the homelessness, we have people who lived in Rochester, which was decimated by the flood. 80% of houses were flooded in Rochester. And that's only half an hour south. Sorry, my geography is not good, let alone my meteorology. So, you know, we had people who were homeless and needing to be relocated to temporary accommodation in Echuca, and the impact that they talked about that leaving everything from their home and their pets and not knowing when they would be able to go back and having to basically camp in temporary supported accommodation. Following on from that, relocation also, you know, even temporarily to Melbourne or wherever else, leads to strain on people for a whole range of reasons. You know, family is suddenly living in cramped conditions, and now I've got to take mum and dad to dialysis, and mum and dad just want to get home because they're worried about their pet, and all those sorts of things, you know, dealing with people's emotions and the uncertainty. What people expressed was the kindness of others and the support that they received and how that helped them through. So if people had to go to other dialysis centres, they talked about the kindness that they were treated with and the acceptance, and, you know, people wanting to help and understanding that how difficult this was for people. And they appreciated the support that our team went through to work with them personally to try and allay their fears, to try to work with them around the changes situation and make sure that they were supported as best we could. We're still today dealing with long-term issues, and people are still unsure about getting back into their homes in Rochester and surrounding areas, and dealing with the financial and social issues that have arisen from that. And so linking people in with other services and support services has been really important. Our take-home messages reflect on what worked well and what we could have done better. Opportunities to always learn when a disaster happens. Second take-home message is collaboration and partnering is so important. We all have a common goal, and working with others to achieve that, to making sure that people receive the care that they need is important to work with others. And communication and planning for success. So putting the time in to plan, communicate, find out what's not hitting the mark and go back and plan again. So that's really the end of my talk. I'm sorry I couldn't share my very exciting photos from our disaster here in this area, but they're available online if anyone wants to Google. So thank you for your time and the invitation to present.
Thank you, Lynn. That was just an amazing memory of, it was only so recent, but the way you described that, and Justin too, and also Kelly and Grant, explaining the first-hand experiences of people who are really at the coalface during these very challenging natural disasters. So it's been interesting to have perspectives about bushfires and floods and things that we don't tend to think about, like, you know, having soot on the roof and affecting the water quality. We take for granted our roads, and yet when your road in and out of the town is blocked by flood water and people can't get to dialysis, and the ingenuity of people and teams who pull together. So just really incredible. I'm just looking in the chat. We're running out of time, and we really have gone well over time, but and we'll probably have to close very soon. Can I suggest, if you've got a question, I'll stay on for a few more minutes, but if you do have a question that you would, and if you would like it to be directed to a particular person on the panel, just send them through. If this is already closed down, when you think of your question, send it through to PKD Australia, to Amy, and she'll be sending out a link to the recording of the webinar, and hopefully she'll also send Lynn's slides as well that we didn't get to have up today. And if you have any other questions, then she'll try and get those answered or addressed. But what might happen is that we'll get so many questions, we'll just have to have another webinar. I think that one of the features that's come home to all of us today is not just the word communication and the fact that people want information. Here we've got the kidney community across quite a few states in Australia, longing for the chance to just connect with other people with kidney disease or linked to the kidney community. And I think it's hard enough having a kidney health problem, but when you add a natural disaster to it and you're trying to overcome your fear of, can you escape? How quickly can I get off this dialysis machine in a shed, as we've heard from Kelly and Grant, or from Justin and Lynn, talking about just the not knowing what's going to happen, what will become of me, where will I go? And how lovely to hear those, that at the end of the day, though, there was great resilience from everybody and people banded together. I heard from the 2 nurse unit managers that they had, not only did they have emergency plans that they enacted, they reviewed them, they met daily, they were constantly upgrading what they could do something better. They were taking on board all the suggestions so that they know the next time something else comes along, they'll be able to do it even better. But people are managing and they're thinking outside the box. I think we'll probably make a few summary notes of things that we've learned from today. I've certainly enjoyed hearing all of the comments. Is there anyone else that would like to say something, a little parting word from each of our speakers? I might start with Justin and Lynn first, because they probably got to get back to work. So Justin, do you have any parting comments or comments that you'd like to make?
No, actually, but I would like to thank you again for the invitation to speak today, and hopefully this helps other units prepare and review their guidelines or look out for natural disasters, because yeah, we've heard that they are quite frequent, unfortunately, in Australia. And yeah, that's about it.
Okay, thank you, Justin, and all the best to you and your team at Bairnsdale, and I hope we meet again. And Lynn, do you have something to finish off with?
Just to echo what Justin said, and how good it is to hear Kelly and Grant from your perspective as well. I think you can't underestimate the voice of people faced with the challenges and going through those health issues. And I think it's so valuable for me as a health professional to hear a consumer voice as well. So thank you for your story.
Thanks, Lynn. And Belinda, you've been amazing sitting here, being with us today when you've got an actual paired kidney exchange happening today. So well done you and all your team, and amazing to think about how you had to rejig things when the borders were closed and when the planes stopped between Australia and New Zealand, and you've had to just keep working with Star Trek. I didn't know about Star Trek and their big role in this. That was amazing to hear that. So would you add anything to finish off with?
I'm sitting here in awe of Kelly and Grant. the things that you, the things that you face, the challenges, how you've just tackled it, it's like another task in the day. You describe it almost like going to the fridge and getting milk. Like it is clearly, but it is not. It is. It's huge. But the way, your experience has been great today. Thank you.
Thank you. Yeah, and obviously Kelly and I, we've just recently completed the paired exchange too, and just extending a best of luck for your patients today on their first leg of their big journey.
Thank
well,
you.
it's actually not the first leg. It's there's a lot of build up, but yeah, it's a big day for them. So we sincerely hope that everything goes really, really awesome, and tomorrow morning everyone wakes up with big smiles.
Big smiles. Yep.
Yeah.
Thank you. Thank you, Yvonne. Thank you to everyone.
Thank you. Thank you again to all our speakers, Maggie, who's already had to leave us, but to you, Belinda, at the Paired Kidney Exchange, to our wonderful nurse unit managers, Justin and Lynn. You do such a wonderful job, and I know everyone that does dialysis, and there'll be a few of you listening here today who just love their dialysis team so much and become family because you're there all the time and you're working together as a team. I also want to thank Kelly and Grant, because your patient experience is absolutely vital for us to expand the wealth of knowledge that people gain. Having kidney disease is a big journey, and we're always learning things all the time. So thank you so much for your generosity of time and your spirit in this. And I'd like to say a big thank you to Angela times two. So Angela and Joan, who are representing DATA, the Dialysis and Transplant Association of Victoria. DATA's been amazing. They've been going for 50 years in Victoria. They've got about 500 people on their books who are members of DATA, and they're all volunteers. And they do an amazing job. So spread the word about DATA, because they just quietly work behind the scenes, and they've supported this today. They support me with Filter Your Future and the education that goes out across Australia. And they're also supporting, I'll just give a plug, on the 7th of May, if anybody's in Melbourne on that day, we're having the world premiere launch of the Filter Fun Park musical for school kids and their families. And if you would be here and you're wanting to go, just get in touch with me at Filter Your Future, and I'll be happy to send you an invitation. DATA sponsoring that. It's free of charge to the kidney community. So if you can be in Melbourne on the 7th of May, it'll be a Sunday afternoon matinee so that dialysis patients can get there as well. So I want to thank you all so much for making this World Kidney Day a very special event. It's wonderful to collaborate with the kidney community, and we've heard from people from all different areas of the kidney community. And what I've loved is that we're all one big group together, and we're supporting one another, and just spread the word about all the great work that's being done right back, from home dialysis to people on PD, people in dialysis units, satellite units, hospitals. And then we've got the Paired Kidney Exchange. What a team. What a wonderful team. And on behalf of all the people at PKD Australia who had to leave us to go and be at World Kidney Day, that the event that KHA has put on at Parliament House today, just thank you from Amy and Helen and all the team at PKD. Any questions or follow-up, just get in touch with us. We'd love to keep in contact. Thank you, and happy World Kidney Day, everyone.